Do you know the MOA and the adverse effects of all these? Trimethoprim, sulfamethoxazole, Cipro, gentamicin, chloramphenicol, tetracycline. These drugs you'll see on every one of your step 1 exams, 1000%. I can tell you that for a reason. So I can tell you because I know. Trimethoprim, you will get it 1000% on your exam. I promise you, you will. So instead of focusing on anatomy and histology and things like epi and biostats, how about you focus on pharm and know every MOA for all these and adverse effects. Now, see this? Let me show you something. Hold on a second. Trimethoprim sulfamethoxazole, as you all know, is always thrown in our vocabulary in the USMLE world, also in medicine. We know that these drug is in combination. Trimethoprim sulfamethoxazole, TMP SMX. I know you know this. Now, I don't know if you know why you give it, because it's used for UTIs, Shigella, blah, 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 blah. Not really care. You should know it eventually, but ideally you should know all that. But if you're trying to grasp pharm, first things first, know what it does, know the mechanism of action, then know what adverse effects, what happens if you take it, like bad stuff can happen. Later, after you know those, by default, after you see more cases, answering more questions, then you start saying, I know it's given for prophylaxis for toxo because I've done HIV questions. I know that. I know that it's actually treatment for pneumocystis jirovecii, pneumonia. Okay, good. Maybe you didn't know about UTIs and Shigella and Salmonella. Now you do. I'm not saying you're going to forget it. I'm not saying you won't going to forget it. You might not forget it. Who knows? But this picture here is very important. Very important. You know that you know trimethoprim and you know sulfamethoxazole. But did you know that this inhibits this and this inhibits this? So AMBOSS has another photo, which I've highlighted before. It's actually pretty cool. It's like a left versus right. This is above and below. I say to myself, when I see dihydrofolate, I know it's this. When I see this dihydropteroate, I know it's always this one. So I can promise you, one of you will get a question like this somewhere. It's either going to ask you if this inhibits this, or if this is inhibited, what happens? And then what's the substrate here? Or what is the MOA? So dihydrofolate for trimethoprim. And the other one is the dihydropteroate. It's for sulfa. So I'm telling you, you need to know this stuff. If you focus on this, I promise you, you'll see the points like, this guy makes sense because every organ system has pharm. There's a lot of pharm, a lot of drugs. And they're going to ask me these questions because people don't know the stupid MOAs. I don't know them. So look at this. Trimethoprim, sulfamethoxazole, Cipro. Do you know that Cipro you can't give in pregnant women? Fluoroquinolone. Yeah, you can't give it in. You can't, kids less than 18, pregnant women. It causes tendinitis. And what's the last thing that it does? QT prolongation. I used to joke last year and say I have a lot of middle names. One of my middle names is QT prolongation because there's a lot of drugs that cause QT prolongation. Do you want to take the drug that causes QT prolongation? I don't. So what they do as a test writer, they write questions to hit you on that. So when I give you a question like this, read the last couple of lines. Ready? Please trust me on this. I've done tens of thousands of questions. You don't have to trust me. You don't do, you do what you want. If you want to save time on any test, read the last 3 lines always. I'm not guaranteeing you'll be able to skip and read and hit the answer all the time. Depends on what you know.